Did you know your prostate can suffer damage every single day without you feeling a thing? Not from illness, not from age, but from simple everyday choices that seem harmless until it's too late. I've spent decades working with older men, fathers, grandfathers, veterans, teachers, and I can tell you one hard truth. Most prostate problems don't come out of nowhere. They're built, one small habit at a time. So if you're over 60 or love someone who is, this message could spare you years of discomfort, poor sleep, expensive medications, and procedures no man wants to face. There are 7 habits I see time and time again in my patients. Men who always ask the same question, why didn't anyone tell me sooner? Today, I'm going to tell you, and more importantly, I'll show you what to do instead. Let's get into it. First habit, rushing through bathroom breaks. Here's something men rarely talk about but do all the time. They rush through urination. They start peeing before they're even fully standing at the toilet, force the stream, tense their abs, push, finish fast, and get out. Why does that matter? Because your prostate sits right below the bladder, and forcing the flow can lead to pressure buildup and incomplete emptying. Over time, that causes irritation, swelling, and more nighttime trips. Men often think, I don't have time to sit and wait for nature to take its course. But your body doesn't work well under pressure, literally. I had a patient, Robert, 70, who was always in a hurry. He prided himself on efficiency, even in the bathroom. But then came the slow stream, then the dribbling, then the discomfort. All he needed, a 2-minute change, sit down, relax, let the bladder empty completely, give your body permission to do what it was made to do without the rush. Second habit, drinking too little water. You'd be shocked how many older men are chronically dehydrated. Why? They don't want to make more bathroom trips. But here's the kicker. Drinking less actually makes things worse. Concentrated urine irritates the bladder and prostate, making you feel like you have to go more often and with more urgency. Your urinary system needs clean, steady flow to flush bacteria, reduce inflammation, and keep tissues healthy. Take Martin, a retired teacher, 76. He cut back to 1 glass of water in the morning and a little tea in the evening. He thought it was smart, but the result? Thick, dark urine, burning sensation, and eventually a nasty infection. When he started drinking 6 to 8 cups of water spread throughout the day, everything changed. Fewer urges, less discomfort, better sleep. Hydration isn't about volume, it's about consistency. A little, often. That's the secret. Third habit, avoiding fiber. What does constipation have to do with your prostate? Everything. When your bowels are backed up, they press against the prostate and bladder. That added pressure inflames the gland and increases the risk of urinary issues, pain, and even infections. The sad part? This is one of the easiest problems to fix. Steve, 68, came to me with classic symptoms: weak flow, constant urgency, pelvic discomfort. But it wasn't his prostate. It was his gut. He hadn't had a real bowel movement in days. Once he added more fiber-rich foods like oatmeal, beans, prunes, and leafy greens, everything changed. So if you're not going regularly, your prostate may be paying the price. Your digestive health and prostate health are more connected than you think. Fourth habit, sitting on hard surfaces. Too long. This one surprises a lot of men. Where you sit and how long can directly affect your prostate. Long hours on hard chairs, car seats, or sofas compress the perineal area, the region between the anus and genitals, where the prostate sits underneath. Over time, that pressure leads to inflammation, pain, and increased urinary symptoms. It's like sitting on a bruise that never heals. Take Jim, a retired mechanic. He loved watching long baseball games in his old recliner. But after every game, a dull ache and burning sensation. It turned out the cushion had flattened after years of use, creating direct pressure on his pelvic floor. The fix? A $20 memory foam cushion and standing up every 30 minutes. If you sit a lot, soften your seat, shift your position, and get up often. It's a small change that saves a lot of suffering. Fifth habit, eating spicy or acidic foods. Late at night, hot wings, chili, tomato sauce, citrus fruits. They taste great, but at the wrong time, they can wreak havoc on your prostate. Spicy and acidic foods eaten late in the evening stimulate the bladder, irritate the urinary tract, and cause nighttime urgency. Tom, 74, loved his late-night snacks. Salsa and chips were his go-to. But then he started waking up 4, 5, even 6 times a night. When we traced his diet, the culprit was clear. After cutting out spicy foods after 6 p.m., his nighttime trips dropped by half. You don't have to give up the foods you love. Just shift them to earlier in the day. Your sleep and your prostate will thank you. Sixth habit, avoiding the doctor until it's too late. Let's face it, most men hate going to the doctor. They don't want bad news. They don't want exams. They'd rather wait and see. But here's the problem. Waiting and seeing often turns into suffering and regretting. Prostate conditions, like benign prostatic hyperplasia BPH or even cancer, often start quietly. By the time symptoms appear, treatment gets harder. Early checkups catch issues before they spiral. And most prostate exams today, they're easier and more comfortable than you think. James, 67, skipped his screenings for over a decade. When he finally went in, he was diagnosed with advanced BPH and had to undergo surgery. He told me, "If I had just gone in 2 years earlier, I could have avoided all this." A simple PSA test and physical exam once a year could save you years of discomfort. Don't wait for something to go wrong. Stay ahead. 7. Habit. Bottling up stress. Your mind and body are connected, especially when it comes to the prostate. Chronic stress triggers the release of hormones like cortisol and adrenaline, which increase inflammation throughout the body, including the pelvic region. Many older men carry silent burdens, financial worries, family concerns, aging fears, but they don't talk about them. They hold it in, and the body pays the price. Chronic stress tightens pelvic floor muscles, disrupts sleep, and increases tension in the bladder and prostate. Over time, that constant strain worsens symptoms like urgency, frequency, and discomfort. Greg, 71, finally opened up during a visit. His wife had passed. He was grieving silently. We didn't just adjust his meds, we got him into a support group. His symptoms eased within weeks. Your emotions aren't weakness. They're part of your health. Speak them, share them, release them. So here's the truth. Your prostate isn't just shaped by age. It's shaped by your habits. Every small choice, whether you listen to your body or ignore it, whether you sit or stretch, speak up or bottle it in, those choices add up. You don't need to be perfect. You just need to be aware. Today is your chance to choose differently. So tell me, which of these 7 habits surprised you most? Which one will you work on this week? Leave a comment below. We'd love to hear from you. And if this video helped you or someone you love, please like, subscribe, and share it. Your support means the world. Take care of yourself, and your future self will thank you. We'll see you in the next video.